We have more on the stunning shutdown of 2 East Louisville nursing homes after a U.S. Department of Justice investigation. Investigators say Hill Creek Rehab on Breckenridge Lane and St. Matthew's Care and Rehab Centers on Browns Lane will pay more than $1 million to federal agencies and close the facilities. The investigation found several instances of elder abuse, criminals hired as employees, and rodent infestations at both of the centers. Well, the 2 nursing homes shutting down in our area were part of a WHAS 11 News focus investigation during the height of COVID. Even then, they faced hefty fines. But while the federal government was penalizing them, focus investigator John Charlton discovered the government was also rewarding them.
Clearly, during COVID, there was a lot of struggling going on, and nursing homes felt the brunt of it. Many of the most vulnerable lived there, and the challenge often became overwhelming to contain infection. That's why the federal government poured money into the facilities, even into the ones which failed to properly care for the elderly. Focus investigated which nursing homes in the Louisville area faced the highest fines when the pandemic started in the U.S. in 2020. Both St. Matthew's Care and Rehab and Hill Creek Rehab and Care were in that group. According to inspection reports at that time by the Centers for Medicare and Medicaid Services, St. Matthew's Care and Rehab had been investigated for staffing certified nursing assistants with expired certifications and for allowing unqualified staff to administer medication. Meanwhile, Hill Creek had been investigated for improper care, including consistently failing to properly monitor a diabetic resident's blood glucose levels. In all, Hill Creek faced fines of almost $66,000, while St. Matthew's Care and Rehab got slapped with fines totaling almost $181,000. The issue we found was that the federal government rewarded the St. Matthew's facility with much more in COVID-19 money, about $206,000. Hill Creek received at least $176,000. At the time, Brian Lee of Families for Better Care, an organization which advocates for residents in long-term care facilities, called the payments bonuses.
Some people would say that that's robbing Peter to pay Paul. You know, it just offsets the enforcement and waters it down. And there's no, again, incentive for the nursing homes to operate better and safer for the residents.
The payments were through the Provider Relief Fund COVID-19 Nursing Home Quality Incentive Program. Nationwide, payments totaled nearly $2 billion, and Kentucky received at that time almost $34 million. John Charlton, WHAS 11, on your side.